chair calls to order legislative session day 20-022. Council, with no objection, I will take this as general consent that we will suspend our rules of procedure to allow the council to meet remotely and with a modified agenda during the ongoing health emergency. I would ask you now to please join us in standing for the pledge, followed by the opening prayer. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Heavenly Father, we come before you this evening asking for your blessings and your guidance as we conduct this council meeting. We're grateful and truly appreciate the opportunity to serve our community. Lord, we ask that you continue to watch over and protect our law enforcement members, our fire and EMS partners, and our military as our country continues to face this pandemic and civil unrest. Please give us strength and courage as we navigate the path forward to ensure our country's business community is fully open, our citizens are back to work, and most of all, our children are back in school in a safe and secure learning environment. We thank you for your love and grace. All these things we ask in your most holy name, Lord. Amen. Amen. Agenda item number 4, presentation of proclamations. Mr. Woods.
Thank you, Mr. President. All right. It just disappeared. Stand by 1 second.
While we're waiting on Councilman Wood, I'd like to welcome him to California. As a member of FEMA, he was deployed recently to Sacramento, or just south of Sacramento, for the wildfire. So whenever you're ready, Mr. Woods. Unmute. Yep.
All right. Suicide Prevention Month, correct? All right. Suicide is the leading cause of death among all age groups and is the second largest cause of death among individuals ages 10 to 34. A single life lost to suicide can affect an average of 115 individuals. And in 2018, 48,344 people in the United States and 650 in the state of Maryland died by suicide, according to the Centers for Disease Control in 2018. Combined medical costs and work loss costs of suicide in the state, which is determined by the CDC, is equal to $586,391,000 in 2010. Organizations such as the Maryland Suicide Prevention and Early Intervention Network, Maryland's been, and the Governor's Commission on Suicide Prevention resolved to integrate and coordinate suicide prevention activities across multiple sectors and settings, develop, implement, enter effective programs that promote wellness and prevent suicide and related behaviors, promote suicide prevention as a core component of healthcare services, promote the adoption of zero suicides as a special goal by healthcare and community support systems that provide services and support to define patients' populations and increase the timeline and usefulness of surveillance systems relevant to suicide prevention and improve the ability to collect and analyze and use this information for action. Now, therefore, we, the County Council of Harford County, Maryland, on this first day of September 2020, do hereby proclaim September 2020 Suicide Prevention Month.
Thank you, Councilman Woods. Council, at this time, I'd like to welcome Natalie Miller, who represents Mental Health Promotion Coordinator and Behavioral Health Administration. Ms. Miller, are you with us this evening?
Hi, yes, I am. Thank you for recognizing September as Suicide Prevention Month.
Well, thank you. Thank you for all you do. Would you like to say anything else?
Nope, that's it.
Well, thank you very much. Council, may I have general consent to move the agenda item 4B to agenda item 6A? Thank you. Agenda item number 5, consideration of petitions, applications, appointments, and nominations. Council, at this time, will act as the Board of Health for the appointments to the Office on Mental Health Core Service Agency of Harford County Incorporated, and resume back to legislative thereafter. A, Board of Health appointments. Office on Mental Health Core Service Agency of Harford County Incorporated. May I have a motion?
Sorry, Mr. President.
Are you looking to second, Mr. Woods? Second. Try again, please. Second.
Second.
Thank you. So it's moved and seconded to approve the appointments of Jeffrey N. Berger, Amy L. Snyder, Diane Magdalene Schultz, Tara Renee Lathrop, Heather Lynn Connolly. Are there any discussion? Anyone? Ms. Dixon?
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Jan Giordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Aye.
There being 7 votes in the affirmative, 0 in the negative, the appointments for the Office of Health Core Service Agency of Harford County Incorporated are hereby approved. B, council appointment, Harford Cable Network Advisory Board, Mr. Woods.
Thank you, Mr. President. I move to approve the appointments to the Harford Cable Network Advisory Board. Ryan Sexton, Armstrong Community Marketing and Program Marketing, and Patricia Parker, Community and Public Relations Manager, Town of Bel Air.
Second.
Mr. Wagner. It's been moved and seconded to approve the appointments of Mr. Sexton and Ms. Parker. Is there any discussion? Ms. Dixon?
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Jan Giordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Beulah.
Mr. Beulah?
Aye.
Thank you. There being 7 votes in the affirmative and 0 in the negative, the appointments to Harvard Cable Network Advisory Board are hereby approved. Executive appointments, Deputy Director of Public Works Division of Highways and Division of Environment and Sustainability. May I have a motion?
Mr. President,
Mr. Woods.
I move to approve the executive's appointment of the Deputy Director of Public Works of Stephen A. Welsh.
Second.
Stephen A. Walsh. And I didn't hear who. It's moved and seconded to approve the county executive's appointment for Deputy Director of Public Works Division, Mr. Walsh. Is there any discussion? Mr. Walsh.
Thank you, Mr. President. Over the last couple of weeks, I've had the opportunity to work with Stephen, and he's been very helpful. Always responsive to the emails, constantly getting back to me, reaching out to any constituent that has an issue. I think the administration did an outstanding job selecting him, and I strongly encourage his appointment. So thank you.
Thank you, Mr. Woods. Anyone else? I too, go ahead, Mr. Schroeder.
Yeah, I too met with him, and I I think he's an outstanding candidate coming from Baltimore County as a Director of Public Works from a much larger organization. I know that he's going to do very well and fit in. He is a Harford County resident as well. And I think he's the perfect pick, to be honest. That's all I have.
Thank you, Mr. Schroeds. Anyone else? Ms. Dixon?
Mr. President,
Aye.
Mr. John,
Aye.
Mr. Woods,
Aye.
Mr. Jan Giordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Biola.
Aye.
There being 7 votes in the affirmative, 0 in the negative, the appointment of Mr. Walsh is hereby approved. Agenda item number 6, special presentations. We're going to start with our COVID-19 update. It is truly my honor and pleasure to welcome Dr. Moy again this evening for his last COVID update, sir, whenever you're ready.
Thank you, Council President Vicente and County Council members. Can you hear me all right?
Yes, sir.
Great. I'm here to give my update on the COVID-19 pandemic. As you all probably know, Governor Hogan held a 4:30 p.m. press conference today, in which a number of major COVID-19 related announcements were made, and which I'm sure are being digested right now by everyone as we speak. And some of those announcements, Maryland will be entering stage 3 of the state's reopening plan on Friday. That means that theaters may open to the general public at 50% capacity or 100 people per auditorium. Outdoor venues where live performances occur or motion pictures are shown outdoors may open to the general public at 50% capacity or 250 people. Retail establishments and churches may increase from 50% to 75% capacity. The governor also announced that in collaboration with Apple and Google, Maryland will be one of the first 5 states to use a new exposure notification express tool to help with contact tracing and slow the spread of COVID-19. So many announcements were made. I'm sure there's much more to come, and we'll keep you posted. Recapping some of the most recent COVID-19 data as of this morning, worldwide over 25 million cases and over 850,000 deaths. In the United States, 6 million cases and over 180,000 deaths. In Maryland, 108,863 cases and 3,617 deaths. And in Harford County, 2,500 cases and 67 confirmed deaths. So some more recent developments. Last Thursday, Governor Hogan had another press conference where he released the state's long-awaited COVID-19 guidance for Maryland schools document. Some of the highlights for that included that the governor has now established benchmarks in order for schools to reopen. These benchmarks are, first, number 1, a testing positivity rate under 5%, and number 2, a new case rate less than 15 per 100,000. So if these metrics are good, then that's evidence that community transmission of the virus is under control and schools may begin to reopen. But if these metrics should get worse, for example, if the positivity rate were to rise by 1.5 percentage points within a 2-week period, or if the new case rate were to rise by 2 per 100,000 within a 2-week period, then the reopening plans need to be reassessed and maybe scaled back. Fortunately, in Harford County, we already anticipated that these 2 metrics would be chosen as the state's benchmarks, so that we've been monitoring them for a while, and we're doing pretty well with both metrics. So the Maryland and Harford County metrics, they're as follows. For the first metric of positivity rate, Maryland's positivity rate today is 3.39%, and Harford County's positivity rate today is 3.65%. The second metric is new daily cases per 100,000 people. Maryland's new case rate today is 8.46 per 100,000 people, and Harford County's new case rate today is even lower at 7.72 per 100,000 people. We are also monitoring a couple of other metrics that the governor did not mention. The third metric we're following is the number of COVID-19 deaths. And in Harford County, we've had a relatively low number of COVID-19 deaths. Back in June, we had 11 deaths. In July, we had 5 deaths. And in the month of August, we had 3 deaths. And then as far as the fourth metric is concerned, we've been following the number of statewide hospitalizations, and that's been at its lowest level since March 2020. So the governor is strongly encouraging all local school boards that meet these benchmarks. He's encouraging them to reopen for some in-person instruction by the end of the first quarter. So to summarize, the challenge is balancing the benefits of in-school instruction with the COVID-19 safety considerations. So we all know that it's really important to have in-person instruction. Schools are a very important part of the community infrastructure. They provide a lot of critical services to children and families. They create a very structured environment for learning and fulfilling other really important needs. And the evidence to date indicates that COVID-19 presents relatively low risks to school-age kids, and children appear to be at a lower risk for contracting COVID-19 compared to adults. And authorities such as the American Academy of Pediatrics, they say that based on the available evidence, they believe that in-person schooling is in the best interest of students as long as community transmission is under control and appropriate mitigation measures are followed. Nevertheless, COVID-19 is still a relatively new disease. There's still a lot yet to be learned about this virus. New research articles are coming out every day. The decisions become more challenging with each new finding. So, for example, although it's widely thought that young children are mostly spared by the coronavirus and don't seem to spread it to others very often, recent studies have shown that children younger than 5 years of age may have up to 100 times as much of the virus in their upper respiratory tract as adults. There's also evidence that children can become infected with COVID-19 and spread the virus to others. So in Maryland, about 10% or 11,800 children under the age of 20 are under the age of 20. And in Harford County, about 8% or about 200 of the county's 2,500 COVID cases are in those under the age of 20. So it definitely does affect children. And even though children are less likely to get sick from COVID-19, there are notable exceptions, such as that multi-inflammatory syndrome in children we talked about a while back. That's that rare inflammatory condition that can affect not just the lungs, but the heart, kidneys, brain, skin, eyes, and gastrointestinal system. This condition is very rare. As of August 20th, the CDC has reported 694 confirmed cases across 42 states, and 11 have resulted in death. And there have been over 30 cases of the multi-inflammatory syndrome in children reported in Maryland. So even if children show few symptoms from COVID-19, no one really knows for sure if there are any long-term sequelae or after effects. So the bottom line is, everyone knows that reopening schools is important, but the prerequisites for reopening schools include, first, and this is the most important, a low rate of community transmission, which we currently have, but we need to keep monitoring, especially since kids can definitely spread the virus throughout the community. And two, tolerance for risk. Because even though kids seem to be at lower risk for serious illness, that doesn't mean no risk for serious illness. And the question of long-term sequelae for kids getting the virus is still not yet known at this time. Just a few more recent developments. So on August 11th, we had a successful Harford County COVID-19 drive-through testing event at Ripken Stadium. We were able to test over 700 folks in a very well-organized, efficient operation with short wait times. The test results came back very quickly by the next day. And this is thanks to the folks at University of Maryland Upper Chesapeake Health, our county government, Harford County Health Department, and our other many partners. Our next step is to develop a transition plan for which the COVID-19 drive-through testing for the county can be done once the VEEP stations, which have been used for testing all summer, go back to being VEEP sites. So the county's testing percentage is now up to 18% of the county's population, and though still a little below the state average of 22%, we've met the state's 10% target. Just a word about testing, since this has been in the news a lot lately. You may have heard about Ohio Governor DeWine, who tested positive on a rapid antigen test, but then had 2 follow-up negative tests using a more accurate PCR or polymerase chain reaction test. The bottom line is there are 3 types of coronavirus tests. One is a molecular genetic test, also known as PCR test, that looks for the virus's genetic RNA in a nose or throat swab. And these are the most accurate, but they can take days for the results to come back. The second test is a rapid point of care antigen test. And that looks for specific proteins on the surface of the virus. These are less accurate, sometimes up to 50% inaccurate, but they can be done very quickly in the office in about 15 minutes. And then 3 is the serum antibody tests, which are blood tests that just look for a sign that a person has had the infection sometime in the past, but is not useful for diagnosing an active infection at the time. And then one other word about testing. You may have heard about the 25-year-old person in Nevada who tested positive for COVID-19 in April after coming down with a sore throat, cough, and headache. And then he got better over time, but later tested negative twice. But then 48 days later, this man started having headaches and cough again. And this time he got so sick that he developed pneumonia and had to be hospitalized. The researchers did genetic sequencing of each of the viruses that this person got and found that they were completely different strains, confirming that he was infected twice with different strains of COVID-19 only 48 days apart. What got researchers' attention with this case is not just that a person got reinfected. What got their attention was that the second infection was so much more severe than the first. This was surprising because they would have thought that the first infection would have provided some level of protective immunity against a reinfection. So here's the conclusion. This is still such a new virus. Everybody's learning so much about this virus. There's so much still not yet known how this is playing out that we're going to have to still carefully watch and monitor this virus over the course of the coming year. As this will be my last briefing to the County Council, let me just end on a positive note. I think with the support of the Board of Health, county government, University of Maryland Upper Chesapeake Health, Harford County Public Schools, and our many, many other community partners and the community at large, Harford County has taken some major steps forward in the area of public health. We've had some major successes working with our community partners in opening the Klein Family Harford Crisis Center, as well as some departmental successes with our behavioral health, clinical health, environmental health, and care coordination and wraparound projects such as our Macon's Place and upstream projects. And as I mentioned to my email to partners, when looking at Harford County's overall health, which has been good, we continue to rank in the top third of Maryland's 24 jurisdictions as the 8th healthiest county. I think I share a recent 2020 second quarter opioid report showing that while overdose and opioid deaths are increasing in the state, they continue to decline in Harford County. So these successes have been a product of our health department's partnerships with you, the Board of Health, and the community, and it's reflected in our health department being doubly accredited, one by CARF, the Commission on Accreditation of Rehabilitation Facilities, and second by FAB, the Public Health Accreditation Board national recognition. With the Harford County Health Department being only one of about 250 of the more than 3,000 eligible local health departments in the country to be so recognized, putting us in the top 10% of local health departments in the country. So although the future is challenging, I know that public health in Harper County will be in good hands under your guidance as the Board of Health and under the direction of Marcy Austin, Harper County's acting health officer, and her excellent team. And that would conclude my remarks. Thanks.
Thank you, Dr. Moy. Council, at this time, it's your time for questions or comments. Anyone like to start? Mr. Schroeds.
Dr. Moy, it's been great to get to know you, especially during what we're going through now. I can't imagine having any other health officer but you as we've been going through this pandemic, especially. And I do know that you have a great team. We are going to have big shoes to fill, but I am optimistic, as you said, with Marcy for now, and the Board of Public Health. Like, we'll have an opportunity to pick someone, but you know, it's been incredibly informative for all of us and the general public having you in this capacity since March, especially. But even beyond that, you know, we've been through quite a bit with opioid addiction and other things, and you've been a great partner, and I wish you well in your retirement and good health for you in the future and your family.
Thank you. Appreciate it very much.
Mr. Giangiordano.
Thank you, Dr. Moy. Now, I guess I've gotten to know you over the last couple of months, and I certainly appreciate all your knowledge. I read a lot, but I think I come back to you for final confirmation on various things on the testing. And actually, I knew there was a bunch of different testing, but I'm glad you pointed that out. One of the questions I had is that I know there's some new testing. I think that somebody from some kids from maybe Princeton or something did a saliva test, and I was wondering if that is any more reliable than the quick test is, and have you heard anything about that?
So my understanding of the saliva test is that it actually is a saliva PCR test, which is pretty accurate, and a saliva rapid test, which may not be quite as accurate. So obviously still in the early stages, but if they can really firm that down, that'd be so much easier to do those saliva tests.
Okay, yeah, that'd be great. I've read a bunch about it, but like you said, I know it's still being tested. I think some of the sports teams were using it to their benefit. I've had a lot of people contact me about getting COVID tests, and they've seen that their doctors, some doctors are not willing to do the COVID tests, and then also it's a long wait, maybe a week to 2 weeks to get it back. Do you have any advice for, you know, if constituents reach out to us and say, hey, I'm having a problem getting COVID tests, you know, whether they're getting surgery or they're traveling and coming back? That seems to be the big thing. If somebody travels, they've got to come back, get a COVID test, quarantine themselves for 2 weeks. If they get the COVID test back and it's not positive, do they still have to quarantine themselves 2 weeks if they're going to a hot zone?
So you have a lot of questions there. For the last question about getting a test. So if you've been exposed to somebody who has a positive test, even if you get a test and it comes back negative, that doesn't mean that that person still has not possibly spread that over to you. And so they ask you to wait the entire 14 days of quarantine. I know it's very hard. These are the CDC rules. Sometimes it's counterintuitive. People don't understand it, but that's the rule for this. Even if you have a negative test, if you've been exposed, the incubation period is 14 days. It's a long time. So you got to wait the entire 14 days. Back to your other question about getting the test and how it's hard. You're absolutely right. It's hard, and that's why we need to develop this. The Ripken testing that was so important, because that was an easy way for folks to get a test without having to go to their private doctor. They could just come right in, And then we, with the hospital, we basically wrote the order and can get them tested right away. So that's something I know we're working on with the hospital very closely on. At this very moment, we're working on different sites. That's a key for folks who have a hard time maybe getting an order. And the third thing you mentioned was how long it takes to get the result. So unless you kind of know these labs, and there's like a bunch of different labs, we get data on turnaround time. But there are some labs that can turn around within a day or two. There are other labs, you may not see the result for a week or so. So, and sometimes that actually changes over time. A lab that takes a week will actually get better, and then like a few weeks later, they can get it to you in a couple of days. There is no sure thing about this. That's why the whole COVID thing, it's like a moving target. It is so hard to follow. It's hard for us to follow it, and we do that every day. But the key thing in Harford County, we need those testing sites. If we can get that, I think we'll be a lot better off.
You need to unmute your mic, Tony.
Sorry, Dr. Moy, how do we get the doctors to agree to test somebody who wants to get tested? That seems like they're turning people away, saying, "Now you don't have the symptoms. I'm not going to test you."
So I'll actually say to their defense, the rules on who you test have actually changed a lot over the last 6 months. So early on, they said only test people with symptoms. Then they said test as many people as you can. Recently, the CDC is saying be a little more selective. I'm sure it confuses doctors. So, I would try to encourage the doctors in Harford County to be more lenient because we'd rather test more. But I'm looking, as a former practicing physician, I can see that they're confused. So it's just a matter of education and encouragement.
So how do we unconfuse them and educate them? If somebody's got an issue, who do we contact? Do we contact Marcy in the health department, or do we, is there anything that we can do?
So probably on different levels, more of a general education of all the physicians in Harford County. And we could probably work with the hospital on that because a lot of the physicians work closely with them. But I think if there are a few individual doctors who are really reticent, maybe we can just do special outreach.
I appreciate that. And Dr. Moy, thank you so much for all your wisdom and knowledge. It really helps me, and I think it helps a lot of people. And I wish you all the best in your retirement, and hope you get to do whatever you want to do and enjoy yourself. Thank you very much for your all your dedication. Appreciate it.
Thank you.
Mr. Wagner?
Dr. Moy, it's been a pleasure getting to know you what short time I've been here. You've done a fine job of communicating back and forth with the Board of Health and with council members as they have issues to resolve, be it COVID or be it something else throughout your health department. And you've done a great job of being at the head of the health department there and supervising and all the committees that you've served on that I've seen you on throughout. It's been a real pleasure, and I wish you the very best in your future endeavors, and hope retirement's good for you. Thank you very much.
Really appreciate it. Thank you very much.
Mr. Beulah?
Yes, Dr. Moy. Just a few comments. Just want to say that you've done an amazing job. It's been an honor to get to know, both an honor and a pleasure to get to know you, and may God bless you in all your future endeavors. And I know I personally will miss you. Thank you.
Same here. Thank you.
Mr. Johnson?
Council President. Dr. Moy, I know you're probably tired of all the thank yous right about now, but I'm going to say it again. I thank you for just your stewardship, your professionalism, and your commitment to the county. You are exemplary. I have one question for you. And the question is that going into flu season, what do you see are the major risks going into flu season right now?
Well, as you know, flu is also a major killer. I don't think that's as well known throughout the country, but flu is a major killer. And the thing is, there's something that can help it, and it's the vaccine. But there are folks who are skeptical of the vaccine, and we just have to keep educating them. They really need to get that flu vaccine, and particularly this season, because a lot of the symptoms of COVID-19 are almost identical in many cases to the symptoms of the flu. So you do not want to like get those two things mixed up. So we just have got to just encourage people and educate people. We got enough problems with COVID, but we don't really have a vaccine for COVID yet. We don't have a therapeutic for COVID yet. But amazingly, we do have a vaccine for the flu. So let's just get that out of the way and let's deal with one problem at a time. You do not want to deal with the twin pandemics during this fall and winter.
Thank you, Dr. Moy, and thank you again for all that you've done for the county. Have a good time on the beach.
Okay, I appreciate it. Thank you.
Mr. Woods.
Thank you, Mr. President, and thank you, Dr. Moy. First, I'll hit you with the question, and then I'll go into your 31 years. So I'm in a unique situation. I'm one of the people that are allergic to vaccines, like the ones that are grown on with the egg protein. Have you heard of, or do you know anything with for people that have the allergy to the egg proteins and the various proteins that they grow a lot of the vaccines with? And is there an alternative?
Challenging situation, because that is one of the contraindications to taking a vaccine if you have an egg allergy. That's something that we probably need to get more of an infectious disease specialist. I think Dr. Eunice is here. He might be able to give you some better advice on that. I think there's probably things that they can do to test to see just how allergic you are to that, to the vaccine, and maybe they can do something about that. But no, you're right. That's a challenging situation.
Yeah, I often hear from people that they're afraid to be considered a never vacciner, but they're actually allergic to it. So, well, Dr. Moy, 31 years of service to our state and the county is very impressive. So, thank you for all these years of service, especially to the last few years working directly with us here in the council. It's been outstanding working with you. Your leadership is shown when anytime we've had an issue, which has always been very minor, you were right on it, your staff was right on it, and it was it's very helpful and made a big difference for our time as the Board of Health. Also, it shows that your leadership and how well-rounded you are from being the physician side with a private practice to be able to lead a department like that. So once again, thank you for your time, your service, and you'll definitely be missed, but be around out here. I'm sure you'll be available if we need you. So thanks again.
Absolutely. Absolutely. Thank you very much.
So Dr. Moy, you spoke about the success that Harford County has with its health partners in combating COVID, if you will, or managing COVID, if it will. And you talked a number of different organizations and people, but the one key denominator has been you. You've been available to all of us, and we appreciate it very much. You and your dedicated team at the health department. I don't know how many calls you and I have been on together, and I really appreciate you giving me Marcy's cell number so now I can bother her instead of you. So what I would like to do is, again, thank you for your service, but I want you to hang on for just a little bit because we're going to ask Mr. Sheldon and Dr. Jonas to speak, but don't go anywhere, okay?
Okay, thank you.
Lyle?
Good afternoon, gentlemen. This is Lyle Sheldon, Council President Vincente. Dr. Moore, I want to echo many of the words that others have said, and certainly as an anchor institution here in Harford County, you've been a humble servant leader, and you've allowed us to really do some remarkable things, whether it's with Healthy Harford, whether it's with the Klein Family Harford Crisis Center, whether it's with the community health assessment surveys, and then I think most importantly, everything that you have partnered with us not only during the opioid epidemic, but also during this COVID pandemic. And on behalf of those of us at University of Maryland Upper Chesapeake Health, good luck, Godspeed, and God bless. So thank you very much.
Thank you. Appreciate it.
Dr. Yunus, would you like to say a few words to Dr. Moy before we leave?
Absolutely. Thank you very much, Mr. President, for giving me the opportunity. And Dr. Moy, it has been an honor to get to know you, your calm, composed, scientific demeanor, and the opportunities that we got to work under some very stressful situation. But I believe we are in a much better place since February as compared to now. And kudos to you and your team and your gentle leadership. And Lyle used the right word, the servant leadership. It truly has been an honor to know you, sir, and to learn from you. Thank you very much. Wish you the very best of luck in your retirement.
Thank you. Appreciate it very much.
Mr. Wood, you want to go ahead and read the proclamation?
Absolutely, President. It is my honor to insert background. There we go. It's my honor to present you virtually, Dr. Moy, this proclamation on behalf of the County Council. Be it hereby known that the County Council of Harford County, Maryland, on this first day of September 2020, recognizes and congratulates Russell Moy, MD, MPH, Health Officer, Harford County Health Department, 31 years of service, and do hereby express our appreciation for his dedication, service to the citizens of Maryland and Harford County, and extend our best wishes for success in all his future endeavors. Thank you.
Thank you very much. I really appreciate it very much to all of you.
Thank you, Mr. Woods, and thank you again, Dr. Moy. We're going to go ahead and now bring Lyle Sheldon forward again, please.
Yes, sir. Good afternoon, or good evening, I should say now.
It all runs together, sir. It all runs together.
Well, certainly, President Vincenti, I'm not sure if we could do the proclamation for the COVID testing efforts.
We're going to do it after Dr. Yunus's report.
Okay, well, great. Well, thank you very much. And as I was talking to Council President Vincenti a couple of weeks ago, we recognize that it's been a long time since your last County Council meeting and Board of Health meeting, and we certainly thought it was appropriate with both myself and Dr. Yunus to share with you an update on what's happened, not only for March, where we are today, but also some of the forecasting that we're anticipating to do. And again, I can't emphasize enough the support that you all as the Board of Health, Dr. Moy as the leader of the Harford County Health Department have been during this period of unprecedented time. So with that, President Vincenti, let me turn this over to Dr. Yunus. And as you may recall, Dr. Yunus has been on our medical staff here at Upper Chesapeake Health for about 18 years. His expertise initially is in infectious disease and infection prevention, but over the last 2 years, he's transitioned to be the chief medical officer for us and has been one of our 6 lead physicians in helping us work through this COVID pandemic within the walls here at Upper Chesapeake at our 2 hospitals, but also out in the community, not only with our community partners, but also with our medical staff. So Dr. Yunus, let me turn this over to you and have you walk through the material that you prepared for the group. So thank you, President Vincenti.
Thank you very much for the opportunity. Thank you for the introduction, Lyle. I have a short presentation that we can go through. And then, of course, I will welcome any questions, Mr. President, any of the council members. You can interrupt me at any point. The important thing, even though I'm the one presenting this is not all my work. This is the work of hundreds of people, including all of you. This pandemic has taught us that this was bigger and is bigger than any one of us single person. And it's a journey of transformation. As you see on the first slide, the first patient that we saw at Upper Chesapeake was on March 8th. And we were the first in the 13 hospital University of Maryland system to see a patient with COVID. And among the first in the state, actually, just a few days before, they had a patient in Montgomery County. And this was an 86-year-old woman who had traveled to Turkey and literally threw every possible curveball. We were literally in a phase of change and transformation all day. And by the way, this patient got better and went home. But from there, the journey of transformation started, where we were now dealing with an invisible enemy that we did not completely understand. And like many other professionals, we simply could not shut our doors and go back home. We had to be on the front line. And I have shared this with the council before. We had daily meetings to manage that change that Dr. Moy was rightly saying. There was a lot of confusion, a lot of change. And our message repeatedly to our team was that we are to this pandemic what the firefighters were to 9/11. This is our front line. We have to work and we have to provide that safety and security to our community. So kudos to our nurses and docs who literally work like soldiers at times. Next slide, please. And it has been not just transformational, but inspirational. I think this slide will give you, I'll share some of our own data that you're not going to be able to find on Google. This slide will tell you the peaks and troughs of Upper Chesapeake and Hartford Memorial. The red lines at the bottom represent Hartford Memorial. As you can see, around the 7th of May is when we hit our peak of 30 patients. And since then, around the end of June is when we literally crushed that curve. And we're feeling pretty good. But then you see a little bit of vibration coming back. Currently, I would say we are at 1/2 to 1/3 of our volume where we were compared to our peak. So the message clearly is it ain't over. We have to remain vigilant. We have to remain cautious. Next slide, please. And again, the transformation picture is worth 1,000 words. On the left side, you see these are our hallways on a typical day at Upper Chesapeake. But that's what COVID did to us when you look at the right. All of these infusions and ventilator monitors and all of that stuff, which used to be in the room, was pulled out to reduce the risk to our teams and their units. You know, this literally, right now you don't see people there, but once you add the hustle bustle of patient care, it was literally a war zone. But we are doing much better now, and I think we rose up to the challenge. Let's go to the next slide, please. And again, the key word in my mind remains transformation. On the fly, our engineering team turned these regular rooms into negative pressure to add another layer of security. Our team, in the middle picture, you see one of the team members who's taking care of the patient with COVID coming out, and another team member who was called a buddy would clean their hood, would clean them and make sure that they doff all that PPE in a safe way. And this would happen hundreds of times every day. And this is not just physically exhausting, it's emotionally nerve-wracking for a team who's going to then go back and take care of their own children and families at home. Next slide, please. I want to share some more data, more granular just for Upper Chesapeake. We so far have seen 234 total COVID patients at just Upper Chesapeake. On the left, you see the demographics, slightly more men as compared to women. And when you look at the breakdown of the ages, about 80% of our patients were over the age of 50, which is sort of reassuring that despite all the changes and challenges, this does impact elderly more than the young folks. And at the bottom, you'll see ethnicity. At Upper Chesapeake, about 22% of our patients were African American. And on the next slide, as you will notice, at Hartford Memorial, that number was different. The 28 deaths out of 234, I also want to comment on that. As a system, now we have the strength of moving patients around when one hospital gets at capacity. So around the May, June time when we were really surging, we would take the sickest patients who would be transferred to Upper Chesapeake from other University of Maryland hospitals. And 6 of those deaths happened in those very sick transfers. So if you look at purely Upper Chesapeake data, our mortality has been around 10 to 12% in those very sick hospitalized patients. Next slide, please. So we can look at the similar data for Hartford Memorial. And once again, at Hartford, numbers are small, harder to draw. But once again, you'll see a couple of facts remain steady. More than 80% of patients are once again over the age, or approximately 80% over the age of 50. But the ethnicity, you see the African American patient number now reaching into high 40s. So that is a significant difference between those two demographics. And we were very mindful because COVID was posing us certain challenges and more mortality or morbidity in certain populations. So we wanted to make sure we were equitable and we were cautious of those things, that we were treating everyone to the best of our knowledge and our ability. Next slide, please. However, the story is turning around. And I think that's transformation is also a good transformation. I wanted to share with you some global data. This is from The Economist. So survival rates in patients with COVID are actually improving. If you look at the blue bar, that's the survival rate at the onset, somewhere around April. If somebody was over the age of 80, their survival was less than 30% once they hit an ICU. That's crazy if you think about it. That's as bad as Ebola. Now their survival is close to 45%. So that's significant change within the past 6 months. And that's the fascinating thing about infectious diseases, that once you figure it out, and I think that number is going to continue to improve. But that's the big picture. What does that mean for us here in Harford County? Next slide, please. If you look at our own survival, and I wanted to share this with you, I think we're very encouraged to see these two curves. The top one represents Upper Chesapeake Health, and every red bar represents mortality. That's when patients died at our hospital due to COVID. And you see how that curve is now getting less populated as we were going on the right. And of course, there is correlation with the volume as well. But even when you adjust it to the volume, I cannot make a statistical statement today, but there is a smell test. Every day, what we are seeing is that our treatment protocols are getting better and patients' survival is improving. Next slide, please. So what is the impact on that team that I shared earlier? People who are donning and doffing PPE all day, they're in harm's way, they have to go take care of their families. We've had 54 team members at Upper Chesapeake who've turned positive for COVID. Now you can say, how have we managed that? And at the bottom, you will see the breakdown. Many of them, about 34 out of 54, self-reported what they believed their exposure was and where that exposure occurred. And many of them could very clearly link it to someone in the community and not in the hospital. Again, another data point in New York City, where there was a massive outbreak, as we all know, the general population's positivity rate was 22%, but the healthcare workers' positivity rate was 12%. Even though these are the people who are constantly in touch with COVID positive patients, counterintuitive, but reaffirms our faith in the PPE, that if you are taking the right precautions, chances are you'll be able to beat this virus. And I've been saying that if you're taking the right precautions, it's probably as good, if not better, than a vaccine. The only difference is vaccine is one time and PPE is each time. But here is one of our team member who is trying to engage a patient with a game of tic-tac-toe. The patient, remember, these were the days when there was isolation, there was no visitation, and these people will feel lonely, and our nurses tried their very best to engage these patients and cheer them up wherever possible. Of course, those restrictions are now much better, and now we are allowing one visitation or visitor per patient when they're COVID negative. And we hope that it will continue to improve. Next slide, please. But one more way, we are now making sure that our team remains energized. What we did was we were having every day open conference call, a question answer with our team member. I'll come to the slide in a minute. But I wanted to make sure I close the thought about how have we taken care of our team internally and also out in the community, because the earlier questions about how do we educate physicians about testing and all the other changes that are happening all the time. So every day we would have a call with our team, but the key thing was that the agenda of the call was set by our team. We allowed them to ask questions through text, through email ahead of time. And they knew they would come to the call and have their questions answered by the experts. There was no other agenda. And that is how we built that understanding. Instead of us trying to figure out their knowledge gap, we knew their knowledge gap because they were clearly asking us the right questions. Then we opened up similar channels with our community physicians. And thanks to Colin and many other folks, Sharifa, who helped us organize that, like Dr. Moy said, we wanted to be good partners where we were not trying to live within the four walls of the hospital. We reached out actively, multiple conference calls with the community docs and their staff. So we could answer exactly the same kind of questions. When is a test needed? Who needs to get tested? What is the advantage of antigen over antibody? Where do I send my patients? What is going on in the hospital? And I think we have built some amazing partnerships and we have built a better understanding and we continue to do that. We plan to restart those calls. We stopped them a couple of months ago as the volumes were going down. This slide helps us see in the future. There are about 26 different projection modeling systems in the country. You could go online and start looking from Johns Hopkins to University of Washington models, but this is our University of Maryland, our own homegrown model that we believe gives us the most precise data. If you look at it, it's not going anywhere near the peak we experienced in May, but it's also not flattening. So once again, I think the message here that these curves are giving us is that of caution. And I think they go as far as December. And as a practicing clinician, if you ask me, I would want us to be very cautious until April of 2021 because of every year what we see in the winter months, the post-Christmas surge of seasonal viruses and influenza. And this year, like Dr. Moy was hinting at, what if we get a twin damage? What if we get a double punch from influenza and COVID? So those are the things on our mind, but we believe we are better prepared. Next slide, please. I have just a couple of more slides and talking about testing. So the PCR test on the right side is typically sensitive more than 90 to 95% of the time, but it can take a day or it can take up to 7 days. So speed also matters in these fast-moving pandemics. And now I'm very proud to announce that due to the efforts of Dr. Fermin Barreto, our Chief Medical Officer, the antigen test pilot is about to start at Upper Chesapeake Health. This is the first hospital in the 13 hospital system of University of Maryland medical system where this antigen test will now be tried, and we are going to validate it, and we are going to sort of do a study to see what's the best way we can use this test, because this is like a pregnancy test. The results will be available within minutes, and we will be able to place our patients appropriately. And it may be, the availability may be better. So we are trying to strengthen our testing capabilities. Next slide. And that's the last slide. I think there's one more, but this is the last slide with a message. So how are we better prepared to manage the next wave? I believe number one is partnerships. You have supported us and you've provided immense support throughout this process. I think the EMS have been great partners. Everybody's adjusted. It was not easy for anyone. And I can tell you, I know the health department and Dr. Moy much better now than I knew a year ago. So it's the time when you can have, when you're comfortable with uncomfortable conversations. So those partnerships have really helped us grow. And I think the vision at the University of Maryland system to become one arms, one system, I think is very powerful. So the ability where we know that if we maxed out, we have 11 other hospitals ready to help us, and we will all be together. If we maxed out on PPE, there is a big ship, a mothership out there, and those things have happened. The system has helped us along the way. So I think number one, we feel we're better prepared. And again, another important thing for your visibility, we've had command center calls with the system 3 times a week, where all the leaders, the incident commanders come together And from a system standpoint, we have a dashboard. I think that's very powerful. Number two is our communication and community testing. As I mentioned, we will continue to open those lines of communication. Half of the battle in managing a pandemic is managing information. If you're managing information correctly, you're going to be ahead. Countries that have managed information better typically have done better. So I think we have a better communication system, and we will continue to strengthen our community testing. Like was hinted earlier, we are constantly looking at how we open up more places where an earlier comment was made about physicians, not only that we constantly educate our community docs that no test should be declined. If a patient comes, it's a longer conversation. My theory is if a patient comes to you asking for tests in the middle of a pandemic, it's very unsettling. If you put yourself in that patient's shoes, a patient's test should be done. So we are trying our very, very best that we can at least continue to aspire towards that goal. Rapid testing at the hospital, as I mentioned, this pilot of antigen test, we are very excited about it. And then better treatment protocols and survival rates, as I showed you. I can tell you in March, we physicians would constantly debate new ideas, new studies. The study was not peer reviewed, but yet that was the best data for us. Now, many of those protocols are much more clear. People talk of plasma. We are one of the most fortunate hospitals. I think we were the first in the University of Maryland system to offer plasma to our patients. And we started that in April, back in April. We've given plasma to nearly 36 patients by now. So we have very clear protocols. We have good supply of medications as of now. And we're seeing good survival rates. And the last point is about vaccine. Of course, we hope that the second wave will not come. That's the ideal goal. But every day that goes by brings us closer to that finish line where we will have a vaccine. And that vaccine, most scientific projections are it's not going to be 100% effective. These vaccines are not designed to be 100% effective. But even if it is 50, 60, 70% effective, and 70% of our population takes the vaccine, that may be enough to crush this pandemic locally. And I think the comment about influenza vaccine, I remember the question was asked earlier. Flublok is one of those new vaccines this year that is not made through eggs, the chicken eggs. So people will, with the egg allergies, there are a couple of options for you this year. You can ask your doctor, you can just text me offline. I'm happy to help you with that, where folks with egg allergies can actually safely get vaccinated for influenza. The way I put it, if there was a hurricane coming and we knew we were going to lose power, wouldn't you go ahead and fix your generator? Because that's what you can do. We have very little control over the hurricane, but we have control over power to some degree. In this scenario, I think COVID is the hurricane where we have less control. But influenza, to some degree, should be that power loss. We should be able to get vaccinated and protect ourselves and be able to mitigate that one single variable. Last slide is essentially a big banner outside our cafeteria, which talks about the home of the brave. And many of our team members passing by, they've written their comments on it. I know you cannot read those comments, but the reality is this journey of transformation that we as a hospital have been, it has given us a renewed purpose. The words like teamwork and innovation and transformation and purpose are usually thrown around in a lot of leadership discussions, but I think we are extremely fortunate to have lived that for the past 6 months. And we hope that where we are today, we are much better positioned. Once again, our goal is that we should not have to hit a second wave, but if it comes, I believe we are in a better position because of all those partnerships. I'll stop here and take any questions from the floor.
Thank you, Dr. Yanis, for your presentation. Council, it's your time for either comments or questions. Anyone? Councilman Giordano?
I hear some background noise. I'm not sure what that is, but
It's Dr. Yanis. If you would close your mic, sir, until it's time to speak. Thank you.
Dr. Giannis, thank you so much for all your knowledge. Appreciate it. I did have one or two questions. First one is not only for myself, but maybe for my colleagues and constituents listening, the antigen test. What does that do, and who's going to be able to get that test? What's that for? And then the second one is, I've noticed that there is some spikes around the world, India and I think Australia, that are having large spikes. Obviously, it's not the weather. Is that their first wave or is that their second wave? Any insight on that would be helpful too. And I hope you're right. I hope we don't get the second wave. And I hope we're prepared for that.
Sure. Let me take those two questions first. So antigen test is to detect active disease. If you're having symptoms or you had an exposure, you're concerned that you have disease now, that is what it detects. Typically, it's a nasal swab. So it's a Q-tip that goes inside the nose. The best thing is the best example I can give you is it's like a pregnancy test where the user can do the test and interpret the test under ideal situation. You don't even have to go to a lab and wait for a result. It just turns a color and you can see whether you're positive or negative. The caveat, as Dr. Moy was also hinting at, that there may be inaccuracies. It may not be 90%, it may be 80%. Those are the kind of things we're trying to validate where it falls. But I think it'll be a game changer because the advantage is these tests are shorter. They're faster, they're cheaper. And how do you bridge that gap of their accuracies? By repeating the test. You can repeat it next day. You can repeat it the day after. It probably will still be better off than a PCR test in terms of cost and speed. So that's the advantage of this test. Your second.
Where do you get that test done at?
So it's not available broadly in Hartford County yet. And that's where I said that we are fortunate to be trying it in the hospital once those trials are coming. But at the same time, what I'm hearing in national news and reading from national articles, that's the real wave right now. Abbott is working on some of those tests. There are multiple companies that are working on those tests. And my hunch is in the next month or so, they should be ubiquitous. They should really become available everywhere. So once again, that's a big thing as a country if we're able to offer that to folks, where now they're free to even interpret that test and freeze them from a laboratory. Your second question, sir, about India and the second wave is a very interesting question. I doubt that they're in a second wave. I think by now the virus has made it very clear that it's immune to seasonality. It started in China in the midst of winter. When it came to Italy, it was spring. It has been just going unchecked in US as well as in India at the peak of summer. And it was still going full speeds in Brazil in fall-like weathers in the southern hemisphere. So the virus is immune to the weather. I think the first wave, second wave paradigm, when we will look back in the rear view mirror a few years later, we may think, this is just my hunch, that it will be a obsolete paradigm because that paradigm comes from 1918 pandemic. And back then, the second wave came when the World War I soldiers went back home. And there was this dissemination of the infection. Well, guess what? Now we have more than 4 billion people who fly every year. So my belief is that dissemination happened during the first wave. And that is why I believe that if we put the right systems in place, we should be able to prevent that second wave. But that's something, history will be written years later. But as of now, I think we all should believe that we are in the prolonged first wave.
Thank you very much. And hopefully no more hurricanes. I don't like that word. So if you could take that one out of your vocabulary, then I think I'll be very happy. So, but thank you for answering those questions. I appreciate it.
Thank you. Anyone else? All right, seeing no other questions, Dr. Yonis, thank you again. Mr. Sheldon, would you like to give us some background on our next piece here with our proclamation. One of the things that we talk about throughout COVID is testing. And if you would, please, if you want to lead us into this.
Yes, good evening again, gentlemen. And as President Vincente and I have been chatting, and you heard my colleague, Dr. Yunus, speak about, just the tremendous work effort that has gone into treatment, interfacing with the community. An area where Upper Chesapeake got very involved was reaching out into the community to provide access for potential patients to get tested for the virus. And one of my dear colleagues here, Vicki Bands, who's our Director of Community Health, who's been with us over 30 years and has been in community health for 15 or 20 years, literally led that effort amongst with our colleagues in multiple locations here in the county. We started out in March, literally in the parking lot at Upper Chesapeake Medical Center in a tent, having patients come in or potential patients come in and get specimens collected. We transitioned to the Bel Air Auto Auction after it was vacated and set up there for a few weeks. And then we were over at the vehicle emissions testing location in Forest Hill, which we are still currently at today. As Dr. Moy mentioned, we were part of a county-wide event on August 11th at Ripken Stadium, where we helped collect specimens for over 720 residents here of this area. And what I wanted to do again is recognize Vicki Bands for the work that she has done in this effort. And I would use the analogy that we used to talk about with the United States Postal Service. Through rain, snow, sleet, hail, heat, and cold, our colleagues here, led by Vicki Bands, were literally out there during the last 6 months, providing the opportunity to collect specimens so that, in fact, our residents here in Harford County could get tested. So that's really the preamble, President Vincente, that I'd like to share regarding my colleague, Vicki Bands.
Thank you, Mr. Sheldon. Well, Vicki, it is truly our honor to welcome you here this evening. And if you wait just a second before you speak, Councilman Woods, are you prepared to read the proclamation?
That's right. Thank you, Mr. President, and thank you, Mr. Sheldon. Whereas Vicki Bands has been serving as a registered nurse in Harford and Cecil County's communities for over 30 years. In her current role as Director of HealthLink Community Outreach, Ms. Bands works to strengthen the quality of life within the community by promoting health and wellness techniques and education. And whereas COVID-19 pandemic that we are facing has presented healthcare workers across the world with additional workloads and unique challenges, Ms. Bands and her team of nurses have facilitated 8,064 tests for the COVID-19 virus since testing began 93 days ago. Since testing from a mobile van, she and her team gradually increased the amount of testing in locations they were able to offer to the community with the Forest Hill Beep Station. And whereas on August 11th, 2020, Ms. Bands organized in testing day at Ripken Stadium, Aberdeen, Maryland, where 720 individuals were able to be tested in just 8 hours. And now, therefore, we, the County Council of Harford County, Maryland, on this first day, September 2020, do hereby salute Vicki Bands, Director, HealthLink Community Outreach, for her dedication during these unprecedented times, and express our sincere gratitude for her service and commitment to the citizens of Harford County.
Thank you very much.
Thank you, Mr. Woods. Ms. Bands, I want to thank you for your service, and if you would like to.
Sorry, I lost all volume here.
That's okay. It's on our end here, they tell me. So I just want to thank you for your service, and I would like you to have a moment to make a comment or two if you like.
I just want to thank you very much for the recognition. My team is awesome, and that's what we do. We are truly dedicated to the community in which we serve, and we are very happy to have been able to do and what we've been able to do and really try to meet this head on. So thank you.
Thank you. Council, anyone have any comments? Thank you again, Ms. Banks.
Thank you.
All right, moving on. Agenda item number 7, approval of minutes. Legislative Day 20-021, June 16th, 2020. Are there any corrections to the minutes? There being no corrections, the minutes stand approved. Agenda item number 8, introduction and consideration of resolutions. Councilman Woods, please read resolution 019-20 into the record for introduction.
Thank you, Mr. President. Resolution 019-20, Master Water and Sewer Plan Fall 2020 Update, introduced by Council President Vincini at the request of the County Executive. A resolution providing for the adoption of the Master Water and Sewer Plan Fall 2020 Update, a copy of which is attached hereto, and for submission of the plan to the Maryland Department of the Environment for its approval and implementation pursuant to Title IX of the environmental article of the Maryland Annotated Code. Resolution 019-20 will have a public hearing on Tuesday, October 6, 2020 at 7 p.m.
Thank you, Mr. Woods. Agenda item number 9, introduction of bills. Again, Councilman Woods, will you please read in resolution 019-20 into the record?
Thank you, Mr. President.
I'm sorry, bill number 20-015.
Thank you, Mr. President. Bill 20-015, Bond Authorization Ordinance, introduced by Council President Vincini at the request of the County Executive. A bill concerning the issuance, sale, and delivery of special obligations funding bonds in the aggregate principal amount not to exceed $17 million to be secured by taxes levied on the tax increment on property in the Peachtree Estates Development District. Special tax on property in the Peachtree Estates Special Tax District to refund or otherwise retire all or a portion of the outstanding principal amount of the Harford County, Maryland Special Obligation Bonds, Peachtree Estates Project, Series 2011, determining certain terms and provisions in connection with the issuance, sale, and payment of such refunded bonds. For the purpose of authorizing the issuance, sale, and delivery by Harford County, Maryland, the county, of special obligation refunding bonds pursuant to Section 19-207 of the Local Government Article of the Annotated Code of Maryland, the Refunding Act, Sections 12-201 through 12-213 of the Economic Development Article of the Annotated Code of Maryland, the Tax Increment Act, in Subtitle 5 of Title 21 of the Local Government Article of the Annotated Code of Maryland, the Special Taxing District Act, in an aggregate principal amount not to exceed $17 million to refund or otherwise retire all or a portion of the outstanding principal amount of the Harford County, Maryland Special Obligation Bonds, Peachtree Estates Project, Series 2011, dated as of March 23rd, 2011, the 2011 bonds, in order to achieve savings in the total cost of debt services for the county on a direct comparison basis or percent value basis, providing that special obligation refunding bonds may be issued from time to time, providing for the payment of costs and expenses related to the issuance of the special obligation refunding bonds, making certain funds and determinations amounts among others, and concerning the public benefit and purpose of such special obligation refunding bonds, providing that such special obligation refunding bonds shall be payable first from the amounts levied on the tax increment on properties in the Peachtree Estates Development District and deposited in the Peachtree Estates Tax Increment Fund, the Tax Increment Fund, created pursuant to Bill number 1010, passed by the County Council of the County, on March 16th, 2010, and approved by the County Executive of the County Executive on March 22nd, 2010, and effective on May 21st, 2010. The 2011 ordinance. And resolution number 14-10, adopted by the County Council on March 16th, 2010, and effective on March 16, 2010, the 2011 resolution, and together with the ordinance, the 2011 authorization of legislation. And second, to the extent the tax increment fund does not contain money in any amount sufficient for payment of the debt services on such special obligation refunding bonds, and to the extent amounts are required for deposit in funds and accounts created within the indenture, providing for the issuance of such bonds to replenish deficiencies therein. From the special tax to be levied on the property in the Beech Tree Estates Special Taxing District and deposited in the Beech Tree Estate Special Tax Fund created pursuant to the 2011 authorizing legislation, and from other funds pursuant to the provision of such indenture, providing that the special obligation refunding bonds may be sold at private negotiated sale, providing that the county executive may determine the terms and conditions for redemption and retirement of the 2011 bonds, authorizing the county executive to specify, prescribe, determine, provide for any approved certain details, forms, documents, and procedures in connection with such special obligation refunding bonds and any other matters necessary or desirable in connection with the authorization, issuance, sale, payment of such special obligation refunding bonds, and such other documents as may be necessary and desirable to effectuate the issuance, sale, and delivery of such special obligation refunding bonds, and generally providing for in determining various matters in connection with the issuance, sale, delivery, and payment of such special obligation refunding bonds. Introduced, read first time, order posted, and public hearing is scheduled for Tuesday, October 6, 2020 at 7 p.m.
Thank you, Mr. Woods. Moving on, agenda number 10, new business, executive request, continuation of Harford County state of emergency. I have a motion.
Who keeps muting me? Someone keeps muting me on your end. Mr. President, I move to approve the executive's request to continue the Harford County state of emergency.
Thank you. Do I have a second? Thank you, Mr. Schroeds. It's moved and seconded to approve the executive's request. Any discussion? Mr. Boniface?
Yes, good evening, Mr. President. In accordance with Maryland's Public Safety Code 14-111, the county executive is seeking the consent of the local governing body to continue the local state of emergency. And it is his intention to continue it as long as the governor has his in place.
Thank you. Thank you. Anyone else to speak to this? Any questions? Ms. Dixon?
Mr. President,
Aye.
Mr. Johnson,
Aye.
Mr. Woods,
Aye.
Mr. Jan Giordano,
Aye.
Mr. Schroeds,
Aye.
Mr. Wagner,
Aye.
Mr. Biola.
Aye.
Thank you. There being 7 votes in the affirmative and 0 in the negative, the executive's request for the continuation of Harford County state of emergency to remain in effect throughout the duration of the Governor Hogan's state of emergency due to COVID-19 is hereby approved. Agenda item number 11, business from the president. As we heard from all of our health partners earlier, Dr. Moy's last day was today. We have been in the process of looking for a health officer for Harford County. We have a committee in place, and that committee consists of the Personnel Committee here at the council, which is Councilman Johnson, Councilman Woods, and myself. Mr. Boniface representing the county executive, Barry Klein representing Harford County Healthcare and the provider community, Health of Harford, Ms. Stephanie Garrity from the Maryland State Department of Health, and Ms. Mary Nasuda from Harford County resident and Harford County Public Schools nurse. We've had 3 meetings thus far to identify some candidates from the pool that received of applicants and resumes. We had a total of 95 applicants. We have narrowed it down to 6, and those interviews will be starting on September the 9th and September the 10th, I believe I'm right. Those are the 2 dates. So we're hopeful. We're looking forward to start that process. So I just wanted to give you an update on that to let you know where we're at. Also, throughout the summer, we continue to have conversations with all of our education partners, superintendent, Board of Ed, and then also all of our elected officials trying to keep tabs on where everything's at. We actually had an opportunity to facilitate a few meetings here at the council chambers for Delegate Griffith so that he could speak to Superintendent Bolson and Mr. Robinson, school board president. And, you know, a lot of questions, a lot of concerns about all of our students. We all recognize that our students are our greatest asset and resource. They represent the future. And we want to make sure that we do everything possible, get them into a safe and secure in-person learning system. We've also been to several ribbon cuttings over the summer months, with probably the last one, Councilman Schroes joined Delegate Griffith and myself at the We Rock the Spectrum along with Ms. Harris and Ms. Caitlin Castillo. And they've done a great job there. Early on, we were asked to come and check it out because obviously the executive orders from the governor would not allow gyms to open up. And we recognized early on that this was more than a gym. This was a unique facility that was designed for special needs children, and we needed to help them get open and running as soon as possible. And we were able to do that along with the help of Dr. Moy, Marcy Austin, and our partners at the health department. And unfortunately, again, we here in the county have lost, well, we lost several people, but we've lost 2 strong pillars of our community here recently. We want to express our condolences to the Fielder and Norman families and friends. Ed Fielder, as many of you know, recently Councilman Johnson put forth Mr. Fielder for Harford Living Treasure, and I'm sure he's going to speak to this later. But he was a council colleague of ours. He served from 82 to 90, and we wanted to absolutely recognize him for his service. And, you know, there's no doubt that he was a councilman way back, but yet he never stopped serving the citizens of Harford County and keeping us aware of his thoughts and ideas on how things should be run, and never hesitated to pick the phone up and call and let you know that. So he's dearly going to be missed. And then also Steve Norman. I've known Steve since we were young boys. He was the owner at Tire Village. Great family, great representation or reputation there at Tire Village doing business with the community. So he is also going to clearly be missed, and I'm sure others will speak to that. And on a personal note, I want to thank everyone for their thousands of prayers. I mean, literally thousands of prayers from our Jeannie and our grandson, who was in an accident on July 4th. Terrible accident. He is recovering well. He was at the house last night, visiting with some friends there so they could meet and see him firsthand. But we appreciate all the prayers, the well wishes, the cards, calls, and then also just this past week, Jeannie lost her sister, her oldest sister, Arlene, And so we want to express our condolences to the family, the Smith family, the Bishop family. And, you know, she is truly also going to be missed. And I know she will be missed by her sisters. And with that, Councilman Johnson.
Thank you, Mr. President. First, I want to say it's great to see you all again healthy and safe. We've had a long summer. We've all been busy this summer, and it's just great to see all my colleagues back safe and healthy for this new season. You know, I just want to say that, you know, my heart is heavy because of Ed Fielder and the entire family. James was my treasurer, and it's just been one hit after another. And my deepest sympathies go out to the Fielder family for their loss of their loved ones. I want to truly thank Dr. Moy for his service and dedication once again to our community. Like I said, he's been nothing but a true professional for us as the health officer, and he's going to be truly missed. I just want to speak also on that we're in the midst of coming to the end of the presidential election season, and as leaders, it's incumbent upon us to really try to tone down the rhetoric. It's simply because we are in an unprecedented time as far as the climate of our country, and as leaders, we have to really set the needle and set the pathway forward, and really show some leadership. So I'm asking my colleagues to stand shoulder to shoulder with me, so that you know, that the citizens of this county understand that even though we have our differences, our disagreements and everything, that we can all still somehow agree to disagree and move forward in a loving and respectful way. And finally, I want to say that I am truly thankful for the people of my district. My district has stepped up in ways that I have never seen before. I see that the community now is coming together more and more as one community and not just as individuals. And it motivates me every day to know that that change is truly happening within District A. You know, it's just a beautiful thing. So thank you to the folks in District A. That's Edgewood, Joppatown, and just a sliver of Abingdon. But I can really, the enthusiasm is there, and they can definitely, the change is definitely in the air as far as coming together as one community. So with that being said, thank you, Council President, and I'll yield my time back.
Thank you, Mr. Johnson. Mr. Woods.
Thank you, Mr. President. Welcome back, everyone. Glad everyone made it back safely and had hopefully somewhat of a restful summer, even though I'm sure everyone did a lot of work. I know we did. A lot of constituent issues we took care of, a lot of visits, and just kept going, especially with the hunt for the new health officer. And just throwing that out there, remember the next meeting's at 5 a.m. for me. So throwing that out there for you. Just keep that in mind, 5 a.m. But it's okay, because most of my mornings have started around 4:30 and have gone until too late. Some after 10, some 18-hour days. So Along the lines of all the disasters, everything that's going on, September is National Preparedness Month. And the message this year is disasters don't wait. So make your plan today. Every month, every week of this month will be another topic. You can get more information about preparedness and getting ready for your own disaster plan at ready.gov. The first week of September is going to be focusing on making a plan. The second week is building a kit. The third week, preparing for disasters. And the fourth week, we'll be teaching youth about preparedness. Once again, all that information is available at ready.gov and also the Harford County website. Our EOC does a phenomenal job with emergency planning. With that, thank you, Mr. President, and have a good evening.
Thank you, Mr. Woods. Mr. Jan Giordano.
Thank you, Mr. President. I want to give my condolences to Steve Norman. I had a great opportunity last couple of years to go in the shop, have my cars worked on. Always pleasant. Glad to see Steve. And also, Council President, I'd like to give my condolences out to Jeannie and yourself on the passing of her sister. My deepest condolences on that. The summer's been quite busy. We've actually started going out and knocking on businesses in our district and letting them know that there is grant money that's available. There was two types of grant, one for $7,500. You had 2 employees or more, one for $5,000 if you had no employees, but you were paying rent or a mortgage somewhere. There's still money available. If anybody out there is hearing us, please contact your economic development or your council person. If we don't use that money goes back. So I implore any other councilman to push that out to make sure their constituents, business owners know about that so we can keep our businesses going in Harford County. With that, we had a few businesses open during the summertime. Homeward Bound Veterinary Services open, Club Pilates, which is where Sprouts is in that shopping center. And then We Rock the Spectrum, with which you had talked about earlier. And I hope everybody stays safe. And it is still hurricane season through another 2 months. So just be prepared. Thank you, Council President.
Thank you, Mr. Jan Giordano. Mr. Schroeds.
Thank you, Council President. It's great to be back and to see everyone. You know, just like all of you, you know, we haven't stopped, and I appreciate Aurora helping me to hold the fort down, and Council District D, Northern Harford County. It's been quite busy trying to help constituents out with many, many different issues, and it's been really busier than ever. Just want to also extend my condolences that were already given to Steve Norman, my dear friend. He was always my tire guy. He was just a wonderful man to be around, full of energy. You wanted to be with him. He was full of life, and we're going to miss him dearly. Also to the Fielder family, and then to your to Jeannie as well, of course. Also, please stay some prayers for my dearest friend, Rosemary Hayjack. She's trying to conquer an illness right now, and we're hoping for a miracle and a full recovery for her. Also, Councilman Woods, it's great to see you. I want you to be safe, buddy. Can't wait till you get back, and we really appreciate your service and for what you do, not only here, but across the country, wherever you're called. So thank you. Also, on some other happy notes, I want to wish my little buddy Maddie reminded me that she wanted me to wish her friend Evan Lloyd a very happy 5th birthday today. And you know, I also want to I wish all of our students, whether you're in an elementary school, middle school, high school, or college, that you know, I know it's going to be a different year. We're going to get through this, and as hard as it's going to be for our kids and our students, it's going to be hard for parents as well, and I'm one of those. So, you know, we'll get through this. Hopefully, we get everything opened up in a safe way soon, and we also get businesses open as well. If we just continue to do everything right, and I couldn't be more proud of our numbers, both at the state level and in our county, and it's because of all of our partners and people really just doing the right thing and being conscientious of what you're doing and all of that. So that's all I have tonight. Thank you very much.
Thank you, Mr. Schroeder. Mr. Wagner.
Thank you. While it appears that the council did take a summer hiatus, if you will, the fact of the matter is the only thing we took a break from was our regular council meetings. Everything else trucked on as normal and somewhat abnormal because it was busier than usual, as Councilman Schroeder mentioned. One of the things that we worked on throughout the 2 months that we had a recess in council meetings was trying to gain access for a lot of people in the District E that do not have access to broadband. And I think it's imperative upon the council and also the county to work forward with Verizon and some of the other companies to make sure that we do get better coverage than what we've got today. Because as I told someone, I said, you know, quite honestly, with working remotely from home as employees and businesses and schools having to do what they're doing and the children having to learn remotely as they are, it's almost become as necessary as the electricity to your home in today's world. So we've got to do a better job of trying to get them to come to the table to bring it a little closer to some of the places without the exorbitant expense that I've been hearing for some of them that have been quoted, things that are just astronomical prices that are unaffordable and they can't get it. We celebrated a business grand opening in Aberdeen at 136 South Philadelphia Road, Wisdom Healthcare. It's the first opening in Harford County. And as they like to say, they're there to help repair lives and help to repair the community. And I look forward to them doing great things there. The retirement of Officer Karen Cairns, who had 40 years of service to the Aberdeen Police Department. I think she was the first female officer there in Aberdeen at the time. She was offered the job in Bel Air, and Bel Air didn't take her 40 years ago, and Aberdeen was very fortunate to pick her up at the time. We've had the Adams and Seabird annexation waiver has been on our plate throughout the summer, and we've been working with them, and Councilman Schroeder, I believe we've been working together to try to get something arranged down there that's going to be suitable for the future. Constituent issues and inquiries certainly did not take a break over the summer months. Met with State Highways, that was in person, that wasn't virtual. We met with them in the last few weeks, and some of the things that were brought to their attention have actually been addressed as late as today. Dr. Bolson, regarding the school year, we've talked with him a couple of times, and that's on their plate to try to get that right. We'll just have to wait and see how that goes in the next short while. Harford County DPW has taken care of many of our traffic issues that we had constituent problems and requests for. And lastly, but certainly not least, I express my sympathy to the Fielder family, the Norman family, and to Jeannie and Pat for the loss. And certainly, you know that we're there, and we hold you all in our thoughts and prayers.
Appreciate it.
Mm-hmm. Thank you.
Thank you. Mr. Beulah.
Thank you, Council President. First of all, I'd like to give Jean and I our sincere and deepest condolences to you and Jeannie in the loss of Jeannie's sister. Also to the Fielder family. And we will continue to pray for comfort and strength. And also to Miss Rosemary Hayjack. I understand she's fighting for her life right now. And Jean and I will continue, as we have in the past, pray that she recovers, has a full recovery. Also, as the legislative aide between the Harford County Council and the Harford County Board of Education, one of my responsibilities is to help ensure that accurate information is disseminated. These are challenging times for HCPS, but I'm confident that Superintendent Dr. Bolson, his staff, our teachers, and the Board of Education, and everyone that's involved with educating our children, they're up for the task, and we'll get the job done. I speak frequently with Dr. Bolson and Board of Education President Jansen Robinson and other board members. And again, these are challenging times, not just for our educators, but for our parents, for children, and we all have to come together and work together to accomplish the mission, which is to provide the best quality education for our children, because they are our future. And I know HCPS is committed to revisiting plans to returning students to in-person instruction safely. And I'm sure there will be more information to come on that in the near future. Because I know that Dr. Bolson and Board of Education members have been working with members of the Harford County Health Department to develop a plan for returning our students to in-person learning. And I have a long list of information, and there's a lot of information available. But I would say that if you are a concerned parent, family member, or just a citizen wanting updated information, a lot of information is available at the HCPS website, which is www.hcps.org. Or you can contact me at my office, which the telephone number is 410-638-3626. Or you can email me at cbula@harfordcountycouncil.com. I will also be distributing information to my fellow council members, so feel free to call them too. You're welcome. And it's good to be back, to see all my fellow council members. I've had the opportunity and pleasure to see some of you in person. Yes, we've done a lot over the summer. As Councilman Wagner said, we just didn't have meetings, but we've accomplished a lot. And that's all I have, Council President. Thank you.
Thank you, Mr. Beulah. Agenda item number 13, comments and input from attending citizens. Just as a reminder, I want to let everyone know during your comments and input from citizens, you'll only have 3 minutes as in the past. So please make your comments brief and to the point. Ms. Dixon, do we have anyone signed up?
Yes, Mr. President, we do have 3 this evening. Our first speaker is John Malamo, who has requested a call back.
Thank you. Let's move on. Number 2, Ms. Dixon.
Our next speaker this evening will be Ms. Shante Ruffin.
Thank you.
Bear with me as I unmute her mic. Ms. Ruffin, you may speak now.
Okay, did you want me to turn my video on or am I okay with it off?
You're okay as is, if you're comfortable with that.
It's okay. Good evening, all. First, I would like to thank all of you for what you do for our communities and county. I know it's a tireless job, but you all give your day-to-day to all of us, and I appreciate that.
Ms. Ruffin,
I have two topics.
I hate to interrupt you, but can you please give me your full name and address, please?
Sure, it's Shante Elisa Ruffin. I live at 900 Shenandoah Court in Joplin, Maryland, 21085.
Thank you, ma'am.
You're welcome. I have two topics to address with you today. One, Magnolia Elementary. Two, Rogers Ford community water issues. I've already said my name is Shante Ruffin. I've been a Harford County resident for over 15 years and a Maryland resident all of my life. I am a mother of 4 sons and a volunteer within the Joppatown community. My children have attended Magnolia Elementary since 2015. My task today is just to bring one clear observation to light that did not begin until the 2019 school year. The resolution tactics with regards to student conflict. Law enforcement, in my opinion, should not be on the list of remediation or appropriate for children K through 5. Parents, we all can agree. We do not want a police officer called on our primary school children simply because they're having a bad day or sometimes a bad week. Perception can go either positive or negative. This is not a McGruff visit as we all grew up with and are familiar with. My request is for diverse and sensitivity training for Magnolia Elementary leaders that will enable them to make a better decision as it relates to our children K through 5. Harford County Board of Education, a central office, has a copy of my 4 accounts. My second topic of interest is the damage being done by inconsistent drainage in the Rogers Ford community. Please refer to cclickfix.com for additional details. Within the 5 years residing here, we have witnessed everything from flooded basements, continuous sinkholes, Harford County confirmed toxic bacteria on Shenandoah Court, in addition to the streets and literally leak days after a rainfall. As residents were left with the county and developers pointing fingers at each other, ultimately they said HOA needed to repair. A house is one of the most costly assets one can have. Action needs to be taken if the ground and platform is crumbling around said investment. The county acknowledged the issue when they installed a drainage system in the backyard of one of the last homes on Shenandoah Court. MRA developers were our board of directors for HOA until July 2018. All water problems began before then. How does our developers resolve our HOA concerns when they are both the same entity? What would be the best method to resolve a situation when ownership is transferred? Example, most of the sinkholes are next to the Harford County drainage and sewer manholes. The county stated that the builder and developer needed to fix the drainage. The builder said no. The developer said call the county. Now they both say HOA, even though all problems begin in between builders and while under MRA HOA. In the 80s and the early 90s, my father used to live in the first home when you turn on Kearney Drive. His basement flooded continuously due to his lack of funds to repair numerous times, and simply being tired of fighting with the county, he foreclosed. I would like for history not to repeat itself, and I know Harford County can do better. I would like to thank you all for your audience and your time and this consideration.
Thank you, Ms. Ruffin.
Thank you.
Third caller, Ms. Dixon.
Our next speaker is Dave Tritt. I will unmute him now. Mr. Tritt, you are unmuted.
Thank you, David Tritt, Forest Hill, 21050. Good evening, Mr. President and members of the council. I want to welcome you all back, wherever back happens to be right now. With that welcome, I'd like to offer a reminder that you are all elected officials in your own right. You were not elected to be lackeys, rubber stamps, or spokesmen for some other elected official. You were elected to protect the rights of those whom you represent. You all ran campaigns, you took policy positions, and when you won your elections, you were sworn into your current positions. When you were sworn in, presumably you took an oath to uphold and defend, among other things, the Constitution of the state of Maryland. Article 8 of the Maryland Declaration of Rights in the Constitution reads that the legislative, executive, and judicial and distinct from each other, and no person exercising the functions of one of said departments shall assume or discharge the duties of any other. Article 9 reads that no power of suspending laws or the execution of laws, unless by or derived from the legislature, ought to be exercised or allowed. Article 44 reads that the provisions of the Constitution of the United States and of this state apply as well in time of war as in time of peace, and any departure therefrom or violation thereof under the plea of necessity or any other plea is subversive of good government and tends to anarchy and despotism. Over the last 6 months, our governor has been cranking out executive orders as he operates with king-like authority, unchallenged by the legislature. As you are all aware, our government was not designed to operate in this manner. Our founders pledged their lives, fortunes, and sacred honor to defend our way of life, to defend the proposition that all men are created equal, and to form our system of divided government with its checks and balances. Indeed, many patriots over the last 224 years have defended these ideals with their blood. The Lord has allowed you to have these positions of leadership not to simply be steamrolled by executive overreach from Annapolis or Washington, D.C. You have been given a sacred trust to defend the rights of Harford County citizens. This does not mean that you are elected to parent us or decide what risks we as free people are permitted to take. It means that you are here to defend our freedom. Many of your constituents are looking to you, our neighbors, and you are our local elected officials to help defend our rights, to earn an honest living, to pay our own bills, to feed ourselves and our families, to help protect our right to worship freely. In short, standing with us against authoritarian overreach at all levels. These are not times for politics as usual. Our freedom is at stake. People are losing their jobs, their income, and their businesses that have been built over generations that provide jobs and services for the community. I pray you all will have the courage to push back on behalf of Harford citizens against arbitrary executive orders, as well as standing in defense of our constitutional government itself. It's not enough to say these are state issues. Harford County folks who have lost their jobs and are wondering how they're going to pay their bills and feed their kids. People are dealing with mental health issues, depression, substance abuse, the list goes on and on. These people need to know that you will have our backs and fight for us and not simply buckle under to executive abuse. I pray that you all will have wisdom, discernment, and courage to make good decisions in this difficult season, decisions which greatly affect those whom you were elected to serve. To the extent that you remain steadfast, yes.
Mr. Tritt, please bring your comments to a close. I've allowed you to go a minute and a half over, please.
Oh, thank you, sir. To the extent that you remain steadfast in defending the rights of Harford County citizens, I remain committed to assisting you in that endeavor. Thank you, and may God bless each one of you and your families. Thank you for the extra time, sir.
Thank you, sir. Good night.
Good night.
Ms. Dixon, we want to try to call Mr. Malamo again.
Sure, Mr. President.
Okay.
Hello?
Mr. Malamo.
Who?
Mr. Malamo.
Oh, you got the wrong number, bud.
Thank you. Ms. Dixon, can you give us the number?
Yes, bear with me 1 second. I'll communicate with Ms. Harris.
Mhm. Go ahead. Go. All right, let's figure out what we're doing.
Olamo.
Good evening, sir. It's Council President Vincenti.
Good evening, sir.
How are you?
To you and to your colleagues. I am well. And you?
Good. Good.
Good.
Whenever you're ready, sir.
Are we on the right line now?
We're on the right line, sir.
All right. John P. Malamo, 2402 Eagle View Drive, Bel Air, Maryland. We begin with a brief review of the zoning situation at the Harford County Airport. Bill 13-004, sponsored by Councilman Trodes and two other then sitting council members, changed the county code to allow general aviation airports by special exception in the CI, GI, and LI districts and in the AG district. As with most Harford County zoning legislation, this change was for somebody. Bill 13-004 passed unanimously. Harford County Airport Owners Group applied for a special exception to operate a general aviation airport as a permitted use at their property, 3538 Aldina Road. Under Maryland law, special exception uses are presumed to be compatible with other uses in the zone. Once the applicant proves that the project meets the requirement, the special exception must be granted as long as the impact is no worse at the proposed location than any other location in the zone. Also under Maryland law, once the special exception is granted, the use must operate as a permitted use, and in Harford County, the use must conform to all of Part 1 of the zoning code. During final decision, Councilman Trodes opposed the special exception because of the possibility that jet aircraft would use the airport. Was that a complete lack of understanding of the zoning law, or posturing for constituents negatively impacted by his legislative actions? Regardless, the gesture was used. Likewise, then sitting council president opposed the airport project because jet aircraft could fly over his property. He recused himself from the final argument and the final decision of the Board of Appeals. Was that a lack of understanding of the zoning law, or posturing for constituents negatively impacted by his legislative actions? Again, a meaningless gesture. Councilman Woods voted to uphold the hearing examiner's decision, correctly so. Based upon the transcript of the hearing and the project presented, the Harford County Airport Owners Group proved that their project would meet the requirements of the code and the conditions of the special exception. Councilman Woods did not vote for the airport in operation today. With all of the discrepancies we have noted, that airport was never presented or approved. The decision of the board was appealed to the Harford County Circuit Court, where it was upheld. There was no relief from any of the code requirements or conditions of the special exception granted. Harford County Airport Owners Group did not appeal the decision of the Board of Appeals or the Circuit Court. They are foreclosed from that effort now. We have reviewed the questionable position of the Glassman administration, its inconsistencies with Maryland law, the Harford County Code, the condition of the special exceptions, and the current operation of the airport. We have noted the curious indifference of the County Council / Board of Appeals toward the laws they have passed and the decisions they have made. This is still about government and governance in Harford County. We will now focus our attention on two elements of the code that specify where airports may be located and their commercial operation, particularly the approach and landing pads. Good night.
Good night, sir. Ms. Dixon, anyone else?
There's no one else signed up, Mr. President.
Thank you. With no one else signed up, this meeting will be adjourned.